Welcome back to Let's Talk Value podcast series. Good morning, good afternoon, good evening, wherever you sit on the planet. We know we have a number of listeners from the 5P, be it patients, be it doctors, be it pharmaceutical companies with various functions, medical, clinical, commercial access, but maybe also more and more health insurances and payers, and maybe some policymakers, because I want to talk about that a little bit today with Nienke Feenstra. Welcome.
Hello, good morning, Vilena. Nice to hear you and talk to you today.
And as a reminder, my name is Verena Wolter. Thanks, Nienke, for reminding me. I always forget that part to introduce myself as the founder and CEO of 5P Healthcare Solutions, which is a small boutique consulting firm to help continue break down those silos in the value chain across the 5Ps. And Nienke and I have been discussing this topic quite a bit over the last couple of years with one main central theme, which is called hashtag value-based healthcare, but we want to do less of name and word dropping, more actually talk about what does that actually mean, to focus on outcomes that matter rather than selling services or other things. So Nienke today has a brilliant career already behind her that everybody's now, able to consult on LinkedIn and other social media. But today she's acting general manager for Takeda in France. So maybe we can also talk a little bit about what's going on locally for Nienke now, who has a ton of experience from Poland. But so you may remember the first question I always like to ask: what does value mean to you more broadly for healthcare when we think about patients or the system, whatever comes to your mind when you think about that high-level question?
That high-level question, value just means doing the right thing for patients in a sustainable way. You need to deliver value and be able to continue to deliver that value. So the sustainability aspect of it is very important. Everyone can come up with an idea that adds value to a patient's life, but it's not always easy to do that in a way that we can continue to count on as time goes on, which is something patient really needs. So doing the right thing for patients in a sustainable way is the essence for me of value in healthcare.
So if we think about what's actually in the way right now, maybe to help our listeners again, because we're all in our day jobs and we have our frustrations, but looking at the ecosystem, what are maybe the couple of things that you do see that are recurrent hurdles and barriers to get there? Maybe the sustainability piece, to do it, have one idea, but then actually pertain it.
I think in order to do something sustainably, we need to be able to prove its value, to underline what it really brings to patients' life. And for that, we need data. And gathering data on a systemic way along a patient journey can be a challenge. Because who collects the data, who gathers the data, who owns the data, who interprets it, what is the value of that, and all the discussions around it, whether it is technical, how do we collect it, privacy, who owns it, but also how do we use it, is something where we still have a long way to go. We see a lot of promising initiatives on registries, national databases, applications that allow us to gather data. But having it systematically done in a healthcare system in a way that allows us to underpin the value delivered is something that we still have to work on. I think so. That's one main barrier. And to immediately continue with the second one, which is I know also very, very close to your heart because we've talked very often about it, is indeed the collaboration. If we want to deliver sustainable value, all the 5Ps, as you call them, need to come together. No one can do it alone. Do we have the level of trust among all the different stakeholders? Do we speak the same language amongst each other? Are we in it for the long haul all together? Those are big questions that we not always have an answer for, or we're not always ready to answer positively in the healthcare systems in which we find ourselves. So I think that's another hurdle that we have to overcome in order to sustainably deliver value for patients.
Do you have any example that comes to mind where you remember having started maybe a pilot around doing these two parts? Like, how do you actually think about which data to collect and who would own them, where to keep them, what to measure, and or who is needed around the table to do this along the patient journey?
If I then look back, I have more experience of more examples from my Polish experience because I'm just a few months in Poland. So if you look at back, a real project like that can quickly take years. There, an example which we had was on artificial intelligence and rare disease, and using an algorithm to ensure that data collected at hematologists, cardiologists, different parts in hospitals could be gathered correctly to speed up a diagnosis for patients with, for example, Fabry disease. The idea is very enticing and everyone instantly sees the value in it. But how to set that up together with a startup company who is able to do that, with the doctors involved, with at that time Takeda in Poland as a supporting partner, that created a lot of questions. How do we set up contracts for that? Also in hospitals, very often it was the first time that they were doing it. So also for their legal departments, but obviously wanted to have a look at it because it concerns their patient data. Everyone was learning on the go. So that was something that took us more time than we initially thought it would, but it was very essential. Those are important learnings for future projects. I think there it took us 1.5 years to really get going based only on that. Only on that. So I think...
1.5 years, quote unquote, only preparation. I'm just kind of echoing this because often we hear, oh, we're like in February, by April, can we start? And I like that you're saying practically 1.5 years. It sounds like forever, but I think it's just a reality check. And thanks for sharing that.
I think it's a reality. I also think it's important for everyone wanting to embark upon that to realize that the pioneering, the firsts, take a disproportionate amount of time. It's a heavy lift, but it's one that will come back to us time and time and time and time again, and that we're not only doing for the project at hand, but to learn on how to do it on a larger scale in different therapeutic areas with different partners. And I think that is very important, to not only focus on the project at hand, but also on the learnings across a certain project to make sure that in the future we can go faster, because we have no time to waste. If we look at healthcare investments across the board, they're already they weigh quite high on all the government spending. We can't continue to increase it time and time again. So we need to find ways in which people can come together and find sustainable patient solutions in a way that are also more efficient. So all the learnings we do in one project need to come to the benefit of a second and a third project, which is also one of the reasons why we need to have that open dialogue on it. We can't afford to learn on our own. We need to learn to the benefit for all of the 5 Ps in order to accelerate going forward.
Along the 5 Ps, and the example you're mentioning is already multi-stakeholder. So you said a pharmaceutical company, a hospital and doctors, patients certainly being asked. I also like the support functions, get in the lawyers early. And I like that you're saying this. I feel I'm often a broken record when I say this in project teams. It's like, where's the lawyer? It's not only a transaction, they should be part of it as we co-create. Yes. I like this example. You said AI, so there are data scientists, there are IT software engineers. So that team is growing very large quickly. And then there's the policy side of it, like health authorities. And now that you're working in France, you and I last year have spoken about a great new initiative, that is with a white paper, or it's even more than a white paper. I think it's a resolution. Yeah. Maybe you can share with us a little bit what is triggered also here from a health authority perspective, or government lawmaker almost perspective.
And when I came to France, I took over here 1st of October in 23. And the year before, there was a big crisis also between the pharmaceutical industry and the government for finance reasons, budgetary reasons. And that led to the prime minister who was there at the time, she's not there anymore, to commission a report to talk about how can we make sure that medication and medical devices can find a sustainable place in the healthcare system, because the way it was functioning was suboptimal. And everyone used the word crisis freely, so I feel free to repeat that. And a report, what was called a New Deal, was published, in which 6 experts from different parts of the healthcare system came together to look at how can we do this in a sustainable way. And they came up with a lot of recommendations to do so. That also includes sustainability from a planet perspective, for example, that includes the role of digital technologies to transform the way healthcare is being delivered, but it also talks about how do we finance healthcare. And that opens the door to, or that encourages stakeholders now to look at how can we make a step-by-step approach towards a more value-based healthcare system also in France. It doesn't come with a practical roadmap. Step A, B, C, D is what we now need to do, but it makes a plea for everyone to really start working on that. And what I found very encouraging about that report is what I heard from people who contributed to it as well. It took a few months for everyone to understand each other, to speak each other's language, to realize what are the challenges from a government perspective, patient association perspective, policymaker, but also pharmaceutical industry, the doctors, et cetera. But then when they did understand each other's challenges, it opened up a very fruitful discussion where people started to think in solutions. And beyond the content of the report and the very logical encouragements to look in terms of content, that way of working, bringing people together, was very encouraging for me, because I truly believe that we need to go in that way. No one can do it alone. We need to do it together. And this report underlined that. But coming back to the content piece, it also suggests step by step, also in France, we need to look at how can you get towards a value-based healthcare system, knowing very well it's very difficult in an established healthcare system where things have to change. And it's sometimes almost more easy to start with the so-called white paper and build it from scratch. Still, there is a realization that the way healthcare is financed right now is not something that can just continue, where new innovations can be added in, because then it will also reach its end.
And thanks, Nienke, for bringing this to our attention. Obviously, in France, it's much more known, and people working in healthcare are aware. I just want to read it. Mission régulation des produits de santé confiée par la Première ministre pour un New Deal garantissant un accès égal et durable des patients à tous les produits de la santé, la durabilité, intégrant les notions de soutenabilité financière, de résilience et d'impact environnemental. And I think it's an amazing example that, once again, you remind us of public-private partnerships. So it's the health, it actually initiated through a crisis. And I like to remember this, because sometimes people ask, oh, with COVID, it has worked. We were able to develop vaccines really fast, but we don't always, luckily, have a pandemic crisis to force people to work together. But again, here was an example of a crisis, like a mismatch. And then the actors decided we need to do something. And then actually there were experts, as you say, invited in the heart of the health authority. And then the policy or the lawmaker took initiative to actually issue that paper, which then now acts almost like an incentive, or as an invitation, or as a permission, as you say, to work on the roadmap and make it practical. And we've seen this with examples in the Nordic, also with Nordic Health 2030, where health authorities issue, a suggestion, and then really bottom up. It's like the top down and bottom up combined approach. And sometimes people ask, but how can we work with FDA, how we can work with EMA, how we can work with La Haute Autorité de Santé. It's like, well, browse and read and listen and discover these type of new deals and documents, then you can act on it. But you obviously need to stay curious and be engaged. So I know in your team, you're also kind of putting a lot of emphasis on not only the core functions, medical and field force, but also kind of these roles around governmental affairs, policy. Maybe you can share with us a little bit that too, because it takes time and space to engage in those relationships and be aware.
Yeah, we do. It all starts with knowledge of the healthcare system and its needs. For everyone in the team, no matter when someone is in public affairs or in a commercial role or in legal or whatever. So that's also where we started. This report came out. So one of the first things I did, I think it was literally in the second week, we took the entire team together and said, okay, what does this mean? This report is clearly an invitation also for pharmaceutical industry to take its responsibility. So if we look at the areas in which Takeda is active, what do the recommendations here mean for us? And we've defined that we want to focus, for example, in that case, on where in the patient journey can we add value? Is it our place or not? how can we then make sure that in that patient journey, we support the right usage of the right drug at the right time? So not everywhere, but really in the responsible way, see how far we can get to personalized medicine. And also make sure that when we do that, we collect the data necessary to support that, so we can underline the value that we create through that. And then we define an ambition that we want to see how that value that we deliver will be recognized. And it doesn't mean necessarily by a price. It can be through a medical guideline, it can be in a tender offer, but to make sure that value overall gets recognized. And we're just moving away step by step from only a payment for a drug. Of course, that will stay our reality for a long time still. I'm not naive. But if we don't start on a small scale, on small initiatives, to underline what the overall value is that we deliver by really taking this recommendation as a starting point. It's not something we made up as a pharmaceutical industry in a corner. No, something that came from the government, where all voices have been heard, and we take the responsibility to see how can we support that. I think we're already signaling we think it's important, and as years go by, can contribute to that. And it's also the reason why we talk about it is an invitation to do that with everyone. As said, no one can do that alone. We want to do that together with all the stakeholders in the healthcare system, but then they need to know that that's something we're willing to do. So we're not talking about it for a sort of a promotion thing or whatever, no, but it's really an invitation for people to join, to see how can we get to this data. And we already have partnerships on that, like Agoria Santé, etc. But we want to take that to a different level. And again, that won't be tomorrow. We know we're in it for the long haul, but if everyone does that, I think we can create magic together. I'm truly convinced of that.
It's almost like a wonderful concluding sentence, but I think we have a couple of minutes left. But thanks for sharing those couple of real life examples, both from your time in Poland and now in France, sustaining the innovation in partnerships. Is there anything you really wanted to make sure you say today on this podium that we haven't covered yet, or do you want to share any concluding remarks before we truly close off this episode?
What I think is, I see so many initiatives in that field, not only in France, but in different countries. You already alluded to it. And I like forums like this that help share that across, that make people believe it's possible. And sometimes people think, oh, wow, if you really want to look at a different way of financing a healthcare system, it can seem like such a high mountain, we're never going to be able to climb it. And it takes sparks like this and like-minded people to get something going that in the end becomes the proverbial snowball. So thank you for doing this. And it's also an encouragement to people across, I don't know who might listen to this, but feel free to reach out. We need to strengthen those networks to make it happen together. And see how we can effectively share all those fantastic initiatives that go on, not only in Europe, but worldwide. Some other countries that have healthcare systems that might not have been advanced find it easier to start from scratch. There might be things that we can learn from that. So the last thing to really say is to stay connected with everyone passionate about this field, to make it move even faster than we now think might be possible. Because I do think it is like a snowball. At one point, there will be pace, and that will help us more than we can imagine now.
Let's keep that momentum. Thank you very much, Nienke Feenstra, and all the best in France.
Merci beaucoup. À la prochaine.